Thank you today for joining on Optimal Ask. Is it okay if we just ask some questions about yourself?
Yes, of course.
So the first question is just tell us about yourself and what's your role in the eye department?
So my name is Safa Elhassan. I'm lead in the urgent referral clinic for eyes, or the unscheduled eye care. I've been the lead since October 2022. I'm also a general ophthalmologist, including cataract surgery. And my role is just to provide a service, managing service and altering service if necessary.
Fine. So how did you end up choosing this subspecialty role?
So it's an interesting thing. I always wanted to do some element of neuro-ophthalmology. This one has that, but it's a new subspecialty, and it's an exciting subspecialty. And there's a lot of scope to do many things, like have research, audit, education, and have a change in terms of clinical impact. We collaborate with a network of ophthalmologists with a society called the British Emergency Eye Care Society, BEACS, and yeah, it's very good fun. It's enjoyable.
Fantastic. Good. You've done a few courses on foreign body removals. What tips would you recommend optoms when removing foreign bodies?
I think generally from the courses that we did on the 14th of May and the 23rd of June, a lot of feedback in terms of optoms didn't feel very confident using the alga brush or the ball, which is but they were much more confident using a needle. So just to say that it's not too tricky, and actually the risk of needle stick injury is very low. But by coming to the course, hopefully that will increase your confidence, and maybe in the future we will run courses again if there is demand for it.
Fine. Why is it important to test for corneal sensation, particularly in cases like HSK?
Well, as you know, herpes simplex is caused by the herpes virus, and that lays dormant in the dorsal root of the dorsal ganglion, and so when that's affected, it causes the sensation, corneal sensation, to reduce. So just it's a good way of helping you differentiate from other corneal pathology as well.
Right. And how would you test for corneal sensation?
What you can do is make sure you don't put any anaesthetic in the patient's eye, and then if you get a cotton bud and take the tip of the cotton bud and just pull it and use that then to touch the centre part of the cornea. Right. You ask the patient if they can feel it. You can also see how the patient's blink reaction, blink response to it. To compare both eyes as well, and you ask the patient if the sensation is equal in both eyes as well.
Very good.
But there is other formal ways of doing it, but this is a sort of subjective, informal way of doing it.
And you can also get reduction of corneal sensitivity in other conditions.
Yes, you can. So patients that have diabetes, they may have a reduction in corneal sensation. Patients that have had previous trauma or any sort of ulcers in the past will have reduced corneal sensation. Anyone that's had laser refractive surgery as well will have reduced corneal sensation. So there are other causes of it as well.
Why is colour vision important, and when should it be used?
Colour vision, we use it often, particularly if there's any patient that have a optic nerve pathology. Okay. So optic nerve is quite sensitive at picking up red-green. So if there's a deficiency in the optic nerve, then you may pick up on it these problems. So cases such as an optic neuritis, it's good to document the colour deficiency, as the disease changes or as the disease goes into remission. I find that the optic nerve or the colour testing changes as well, and it gets better. But for any optic nerve pathology, always try to use an Ishihara colour chart to check that.
Great. People reactions. When do you check people's reactions, and what's their significance of checking people's reactions?
Again, it's similar to the sort of cohesion that you want to check the function of the nerve, the optic nerve. So you're looking at the afferent visual pathway. So you're looking for an RAPD or microscan pupil response. So if there is a problem or dysfunction in the afferent pathway, if you shine the light in the non-affected eye, it should respond normally to light, where it constricts. If you swing it over to the other side, you find that the pupils don't constrict, and then you swing it back again, it will constrict, and you'll find that the other pupil constricts. But when you swing it back, it won't constrict, and the other pupil doesn't constrict too. So again, it shows you if there's a pathology again, and that's an objective test as well.
Fine. And quite common in secondary care is B scans. Not often seen in opticians. What's the importance of a B scan?
B scan is really important when you have a pathology that affects you to be able to visualize all the structures in the eye. It's a ultrasound technology, and it's very good for things such as sort of dense vitreous hemorrhages. If you're wondering whether there was a retinal detachment there, a patient who's diabetic, you're not too sure, and even detects retinal detachments. It's good for monitoring choroidal melanomas and other things, some rare things as well, like posterior scleritis as well. So it's a very useful tool actually, even with optic nerve as well. If you've got optic nerve drusen, it helps as well pick that up.
Fantastic. And what advice would you give optons calling eye casualty generally?
I think it's just if you give the history, age of the patient, it's always important to start off with that, and duration, and which eye, provide the visions and the pressures, and your working diagnosis. That's really important to add those factors in. What's your main concern? So that helps us as well. And also, imaging is really useful as well. We can ask you to send images, so it'd be really nice to have that ready. That also helps us triage patients.
Excellent. And finally, what do you think the role is of an optometrist in eye casualty? Because I know you've got some news.
Oh yeah. We are looking to set up a enhanced hospital placement for optometrists, and this is really exciting. And what they will do is we are using the OPT curriculum to create a placement so that you can learn the necessary skills in emergency eye care, and to have the OPT sign off. If you haven't had your IPOS sign off also, this is a good time to do that as well. If anyone is interested, they can contact Nick Sheen. He's got more information about this new role.
In Swansea?
In Swansea Bay, yes, in Singleton Hospital.
Fantastic. Thank you very much, Safa.
Thank you.